Hey everyone, Chad Kaysen, and I just made a quick video for you guys to check out that I'm hoping will help you as we go through this upcoming annual Medicare enrollment time, and you're kind of navigating all these Medicare changes that you're hearing about and seeing out there. And so again, the annual enrollment period is October 15th through December 7th of each year. All right, so let's take a look at the different changes and how you may be affected. All right. And actually, let me just scroll down and get rid of myself here. Okay, so CMS, they released the Medicare premiums, deductibles, and cost sharing amounts for the following year, typically in the fall, usually, December is when that comes out. Your costs are determined by the type of coverage that you have with your Part A and Part B, okay? And so, for example, like Medicare premiums, your Part B premium, right? The Part B deductible, that sort of thing. So, and this might be a lot of you guys right now, but if you've received an annual notice of change in the mailbox from your insurance plan, you may or may not be too happy about it. But basically, if you have a standalone Part D drug plan or one of these Medicare Advantage Part C plans, the insurance plan has to mail you this document each year detailing important changes to coverage, costs, and networks for the upcoming year. All right, and so you should definitely review this document, and it typically arrives by September 30th, right? And it's going to help you decide if you need to make any kind of changes during this annual enrollment period. Okay. So what's driving some of these premium increases that we're seeing on specifically the Part D drug plans, but also some of these Part C Medicare Advantage plans? Well, it's the Inflation Reduction Act, okay, and that was signed into law back in 2022. And there's just different parts of this legislation that are kind of being phased in and over, 2024 and now 2025. And so, yes, even though, the law is lowering beneficiaries' max out-of-pocket costs, for covered prescriptions with their drug plan, $2,000 in 2025. That's when it started, which was down from basically $8,000 out of pocket in 2024. And that it's shifting more of the cost burden to the insurance companies in these Part D plans. Okay. So for example, and I'll show you on the next slide here, it's really driving this stuff. So insurance companies are having to cover more of the costs, right? With the new 2000 annual cap on drug spending, which started this year. Again, these plans are responsible for paying a larger share of these high cost prescriptions. Government cost sharing shifts. Yes, the Inflation Reduction Act reduces the amount Medicare pays for catastrophic coverage. So in 2024, that if you hit the catastrophic phase of your drug plan, you still had this 5% co-insurance up to your true max out of pocket for the year. So that's gone away. And also, bye-bye to the donut hole. Some of you guys remember that, right? So again, that's contributing. Drug price negotiation impact. Okay, so even though they're lowering prices for some of these medications, again, these plans are adjusting premiums to balance the financial risk, right? Also, one program that started this year was the Medicare Prescription Payment Plan with every drug plan. And so those who have more expensive medications that get hit with the deductible and these big upfront costs, like in the first month or so, or whenever they go to fill the drugs, in the first time during the year, usually that can be a big upfront cost. So this program or payment plan helps kind of spread those costs evenly throughout the year. And again, those are more administrative costs for plans, so that can also be factored into premiums. And then uncertainty in plan bids. Again, these changes are new, being phased in, every year a little bit here and there. So insurance companies are just building in these higher premiums as a precaution against these unexpected expenses. All right. So what should you do? Let's talk about it. All right. Quick recap. So you're pretty much in either one of these situations right here. And this is just in the Medicare and You official handbook. So original Medicare Part A and Part B, you join a standalone prescription drug plan, Part D, and then maybe a Medigap plan, Medicare supplement plan, right? That's one scenario. Okay. The other is Medicare Advantage, also known as Part C. And again, these insurance companies, the Humanas, Aetna, Anthem, Cigna, all these guys, they offer both types. They sell the Medicare supplement Medigap plans, and they sell these Medicare Advantage Part C plans, and they offer these drug plans, these standalone Part D prescription drug plans. So it's important to kind of know the differences. You can kind of see right there some of the bullet points there on the differences with these plans, but ultimately you're going to end up in one of these options. All right. So if we go to the next one here, all right. So let's talk about it. So if you've got a Medicare supplement, Medigap plan, right, like a Plan G or Plan N, here's what you can do during this time of the year. You should definitely review your Part D RX annual notice of change, okay, for your prescription drug plan. You're not going to get one of these annual notices of change on Medigap plan because the benefits don't change each year, okay? So again, if you're getting an annual notice of change and you have a Medigap plan, it's going to be for your prescription drug coverage, right? And so you want to review that. Now, if that notice says that your plan is being discontinued, you must select a new plan. You can shop and compare your Part D plan by visiting my website. I have a new website here, which I'll talk about a little bit later, partdplans.com, and there's a video on that link that will show you how to use this new tool, but you can shop and compare your Part D prescription drug plan there. And look, no action is required to remain enrolled in your Medigap plan. And if you're satisfied with your prescription drug plan, you don't have to do anything, okay? And you could also, during this time of year, if you decide that you want to get out of your Medigap plan, you could switch to a Part C Medicare Advantage plan. All right. Now, have you received a Medigap rate increase? Medigap plan rate increase? Well, yeah, you can apply to change or lower your Medigap plan rate at any time during the year, subject to health underwriting approval. Okay. Now, there are some birthday and anniversary rules states out there. So if you live in certain states, you can change your Medigap plan at specific times without health underwriting. All right. But you must already be enrolled in a Medigap plan to do this. Okay. And here's a list kind of showing you some of these states, right? So, for example, these yellow states birthday rule. Again, if you're in any of these yellow states here, you have a specific amount of time surrounding your birthday month where you can change your Medicare supplement plan without any health underwriting. And depending on the state, there's some state specific rules as to, if you can have to keep the same plan or maybe, go from a plan with, you can't maybe go from a plan with less benefits to a plan with more benefits, that sort of thing. So again, if you live in one of these states and you want to discuss this, we can definitely do that. But you can kind of see, and then you got some of these year-round open enrollments up here, Northeast, and then really just one anniversary state right here, policy anniversary, where you can change. Again, in my opinion, just a side note, is that these are just going to drive the rate increases even higher and the premiums even higher in a lot of these states because they have to accept any and everybody, on or around their birthday, right? So again, we can discuss that if you would like. All right. Now, we'll talk about if you have a Medicare Advantage Part C plan, like an HMO or a PPO, an all-in-one plan. All right. Well, here's what you can do. You can review your Medicare plan's annual notice of change. Again, I highly encourage that. Shop and compare your Medicare Advantage plan by visiting my website, partdplans.com. If you've been, notified that your plan is being discontinued, you must select a new plan. Now, some of these plans you'll be like some of these Medicare Advantage plans, they'll change names. So they might map you to a new plan name, right? So in that case, you would want to compare that new plan name that you're seeing there. And you could definitely make a change if you wanted to. But if you've been notified that it's been discontinued, you really want to take some action, okay? Look, if your plan's not being discontinued and you're satisfied with it, you don't need to take any action, okay? And a little tip, every year between January 1st and March 31st, we have the Medicare Advantage Open Enrollment Period. And so if you already have a Medicare Advantage plan, in this 3-month window, every year, you can make a one-time plan change, okay? So, even though there's a lot of hustle and bustle and you got to do it now out there during the fall, we have like 3 months at the beginning of the year where you can also take advantage of the Medicare Advantage Open Enrollment and make a plan change if you're not satisfied. Okay, so we can also talk about that if you're interested. And one other thing you could do is if you want to get out of your Medicare Advantage plan, you can return to original Medicare and apply for a Medigap plan and then enroll in a standalone Part D RX plan. So if you want to talk about that, We could talk about what that looks like, okay, and the qualifications and all of that. Now, what do you need to consider when shopping and comparing Medicare Advantage plans? All right, well, I would say, okay, well, what are your top two concerns or priorities that you have about your Medicare coverage in the next year? Reducing out-of-pocket costs, prescription drug costs, provider flexibility, dental, vision, hearing, grocery cards, over-the-counter benefits, Part B give back. Just be thinking about some of that stuff. Are you going to be traveling more? Are you going to be moving next year? Okay. But the biggest thing with these plans is you want to understand the benefits, but you want to ensure your doctors, your specialists, and your preferred, hospital, local hospital, are in that plan's network for that given year. And again, these networks change annually. Also, you want to ensure your prescriptions are covered and understand your costs at the pharmacy. All right. Okay. Oh, and there's my crazy family. That's us sweating to death in Florida earlier this year. But my kids, they're just not too thrilled with us acting goof here. But anyway, so we can get through this busy time of the year together. All right. Let's explore and compare your Medicare coverage. Visit my website below to begin, partplans.com. Again, the 2026 or whatever year we're going into, those plans are always going to be released October 1st. So that's really when you'll be able to start seeing the following year's specific plan details in your county. Now, again, it's an easy to use, secure platform, personalized plan quotes, and you can enroll directly from that website, that link, if you find the right plan. And of course, help is just a call away. I'm always here to help guide you through all this. We could set up a call, discuss it all. Of course, we'll do that. And you can see my contact information there. And again, most brokers and agencies, and this is just a required disclaimer here. Let's see if I can move this thing out of the way. Move it over here. But CMS, makes us say this, and it's true. Okay, most brokers and agencies, including ours, don't offer every Medicare plan, every single Medicare plan with every company in your area. All right, and we're limited to those that we do. So, for more information on all your Medicare plans, you should get in touch with Medicare or call Medicare at 1-800-MEDICARE. Go to Medicare.gov, use the Medicare Plan Finder, that sort of thing, and you can really see every single option that is available. But again, I'm here to help if you have any questions within this stuff. And like I said, when you visit partplans.com, you will, let's see if I can get myself back up here. So when you visit partplans.com, I've got a video there that you can watch that'll guide you through what to do, and then a link that you'll click on, and then you can go through that and enter your doctors and your prescriptions and that sort of thing, and just start to compare plans. And if it makes sense for you, go ahead and select and enroll in a plan. And of course, I'll be your agent and that sort of thing. So, but again, please don't hesitate if you have any questions with this stuff, and we'll go from there. Thanks for watching. Bye-bye.